Everything else is secondary in most conversations, unless you have a client on the line saying, David, I need a plan that's going to cover an MRI with a copay from day one. That's just a random explanation there. Most case scenarios, you're going to talk about the deductible, the out-of-pocket max, and then the copays. Positioning the deductible. I work with a lot of agents. I listen to a lot of agent calls, and I see a lot of agents bring on a lot of confusion when it comes to the deductible. Don't just say, all right, Mr. Sugars, your deductible is $5,000. Your out-of-pocket max is $10,000. The premium is $350 a month. Does this sound good to you? Don't just say the numbers. Say your deductible is $3,000. This is when major coverage kicks in, but many services are covered before this. Letting them know that there are usually day one copays on most plans removes fear and confusion. I've had clients who say, "Well, David, this deductible is $5,000. Does that mean I have to hit $5,000 before my plan covers anything?" No, that's not the case at all. And then I show them. What a lot of agents do is just read the deductible, read the out-of-pocket max, and try to get the enrollment, which is it's okay to do that, but it's definitely not. It causes a lot of confusion, a lot of follow-up questions. Out-of-pocket max. Position it as your worst case financial protection. Health Sherpa actually calls it a safety net. I love that analogy. You could say something along the lines of no matter what happens in the calendar year, this caps your total cost. Heaven forbid you get in a car accident, you go to the hospital, you get a $200,000 hospital bill. Your out-of-pocket max is meant to protect you from those kinds of costs. Another great way to position an out-of-pocket max, build trust, help them understand what that truly means. Preventative care. Highlight. All plans have a $0 preventative care service. You can position that as you get value even if nothing goes wrong. From day one, you could schedule a preventative care appointment and you can go see your primary care specialist as long as in network. And you are able to utilize these benefits from the get-go. A great way to position the plan and highlight that. Network plus specialist clarity. This is very important. Quick but critical. Do they need a referral to see a specialist? Yes or no? Make sure that they do need to see a referral to see a specialist. They understand that they have to go through their primary care doctor before that will get approved. Make sure you go over in-network versus out-of-network. So talk about what doctors they already have, if they have doctors. If they don't already have pre-existing doctors, that's okay. Just they need to see in-network ones on the plan to get the best rates. Again, position it something simple as this plan works best when we stay in-network. If it's an HMO, an EPO, more than anything, that plan really only works when you see in-network doctors. And I'll show you an example of that coming up here in a few minutes. In a few minutes, I mean right now. Let's go over a quick live summary of benefits walkthrough. I'm going to actually pull up a plan. I just was doing this minutes before this webinar. I was meeting with a client of mine. This is in an Ohio zip code. This is an off-exchange plan, so there are no premium tax credits. It is for him and his two kids. He higher income, he doesn't qualify for premium tax credits, and he wants a gold or platinum level plan. So how often will we run into a scenario like this? Good question. But let's take a peek here. The plan we were looking at was the Ambetter Health Solutions Platinum Zero. From a quick standpoint, many of you can see monthly premium 1,831, deductible 0, out-of-pocket max 5,000, doctor visits $10, specialist 20, generic drugs 3. Most cases, that's okay. That's enough information for a client to understand, especially at a $0 deductible with day one copays. We'll go over two examples here. I'll jump into maybe a bronze or silver level plan. Two ways you can go about reviewing the summary of benefits. You click plan details. Health Sherpa, if that's what you utilize, they do a great job of showing you before and after deductible is met if you just scroll through the plan details. This is not the official summary of benefits document, but it's a very clear and easy way to give a presentation. I do probably 90 or 95% of my enrollments over video call. Those of you who do telesales or they strictly do phone calls, it's a little different. Not that it's impossible. You can have them either follow along on their end or just be very clear and explain it to them carefully. The reason I really like this view is because it does show that before deductible and after deductible very clearly and very simply. Now, the actual summary of benefits coverage, it's going to be under the official documents, and it's going to be the summary of benefits and coverage PDF. You click this, it's going to redirect you to something like this. Now, if you've never seen a form like this before, that is completely okay. Every single plan has a document that looks just like this, obviously tailored to the specifics. With that being said, this will go over the deep into the weeds, as deep as you want. You can get even deeper if you go to a official plan document. Some of them have 100+ pages. Well, this is great. You have a client who says, okay, what about a chiropractor? What is a chiropractor going to cost if I need to see one? I like to do a quick Control F. Chiropractic care. Okay. I typed it on my Control F. It pulls it down right here. Other covered services. Limitations may apply to these services. This is not a complete list. Please see your plan document. However, it pulls up chiropractic care limited to 12 visits per year.